right, case number 6. Patient is 32-year-old female, G1, P1, Gravida 1, Para 1, and with recent diagnosis of gestational diabetes, who presents at the OB clinic at 32 weeks of gestation with complaint of persistent headache. She says she's been having persistent headache for the last 2 or 3 days, and she has tried ibuprofen, Tylenol, which did not help. Her blood pressure has been running around 140, 150s over 90 at home. In addition to that, she says she's been having lower extremity edema, which has been progressively getting worse. So she comes to the OB clinic and she was sent to the hospital for observation. The next day, her blood pressure rises to over 160 over 100, 110. Urinalysis shows proteinuria 1+, protein in the urine. Protein to creatinine ratio is 0.3. Platelet count is 100,000. Otherwise, LFTs are normal. Other labs are normal. Biophysical profile, or BPP, is also normal. Now the question is, what is happening to this patient? What is the most likely diagnosis? Let's say her blood pressure is 130 over 80 or 140 over 90, but she has peripheral edema or lower extremity edema and 1+ protein in urine. Would you treat her blood pressure at the gestation age of 32 weeks? Given her current condition, her blood pressure rising to 160 over 110s, what would you do? How would you treat her condition? The other question is, what are the feared complications of this condition, and what can you do to prevent or to avoid those complications? And when do you want to deliver this baby or this patient? And based on when to deliver this baby, what kinds of treatments are needed, to protect the baby or the mother? And if her platelet count keeps dropping, at this point it's 100,000. If let's say it drops to 50,000 or 20,000 or 10,000, at what point do you consider transfusing her? And the last question is, what are the risk factors for this condition? And is there anything that you can do to prevent it? Are there any preventative measures that you can take, or that you can help the patient to be on or to do? So those are the questions, and let me know what you think about it in the comment section. All right. Peace.